For this afternoon and tonight, a significant winter storm, including heavy snow with limited trainings.
Hello and welcome to the Snowbrains podcast, where it's my job to interview the most intelligent people in the snow sports industry and pass their fascinating knowledge on to you, our listeners. I'm your host, Miles Clark. I'm a professional free skier, a professional mountain guide, a UC Berkeley molecular cell biology graduate, as well as a founder and CEO of Snowbrains. The Snowbrains podcast is brought to you by Alta Ski Area, celebrating their 83rd year of the greatest snow on Earth. My guest today is Dr. Michael Fischman M.D. Dr. Fischman is an occupational and environmental medicine physician and toxicologist. He serves as a consultant in these fields to large organizations such as Intel. Dr. Fischman is a clinical professor in and the assistant chief of the Division of Occupational and Environmental Medicine, Department of Medicine, at the University of California, San Francisco. Dr. Fischman received his medical degree at the University of Michigan and his master's degree in public health and environmental health sciences from the University of California, Berkeley.
Go Bears!
He did his residency training in internal medicine and in occupational medicine at the University of California, San Francisco, and is board certified in both fields. And finally, Dr. Fischman is also my dad. Welcome to the Snowbrains podcast, Dr. Fischman. Thanks so much for being here. How are you?
I'm fine, thanks.
Good. All right. I'd like to start with some COVID-19 numbers. According to the CDC, the USA recently passed 7.3 million people infected with COVID-19, which is a little over 2% of our population. The USA has now seen over 210,000 deaths from COVID-19, and over 4.6 million people have recovered from COVID-19. According to Johns Hopkins University, the current death rate of COVID-19 is 2.9% in the USA. For contrast, the common flu's death rate is around 0.1% globally. Worldwide, we have seen over 33 million people infected with COVID-19. The coronavirus hugely impacted the ski industry last season, shutting down nearly all the ski resorts in North America on March 15th, 2019. All North American ski resorts will require face masks, social distancing, decreased capacity, and more precautions this season. This will be a ski season like no other due to the coronavirus. My opening question to you is, are face masks our best weapon against the spread of the coronavirus right now?
So the answer is that, the studies suggest that face masks are quite effective at reducing the risk of transmission from the mask wearer to others, but also protecting the mask wearer. Some studies that suggested about 70% effective at reducing transmission. So in answer to your question, they are certainly one of the best tools that we have to protect people. Social distancing is also another important tool.
What type of face mask should we wear?
The masks that have been tested most often are surgical masks, but there's still, I think, a shortage of those. The CDC and other authorities recommend wearing cloth masks. And in terms of the type of cloth mask, it's said that one that have multiple layers of cloth are probably more effective than a single layer of cloth. But if you have access to surgical masks, those are probably the most effective. Of course, if you were in a situation where you were likely in a hospital setting generating aerosols during, say, intubation of a patient, then the healthcare worker would wear an N95 mask, which is even better in terms of filtering out particles that might contain virus.
Absolutely. Yeah. I've seen some studies saying that the neck gaiters, which are a single ply of cloth, are one of the worst, least effective. What you're saying supports that. The message to our listeners is, if you can wear more than just the neck gaiter, having a 2-layer cloth mask would be better.
Yes.
And we're kind of hoping ski resorts will even just have free surgical masks to grab at the bottom of the ski resort. So how easily does the coronavirus spread outdoors, let's say at a ski resort?
So I don't think, obviously there's not been any study done at ski resorts, but in terms of outbreaks, there really are very few that occurred in outdoor settings, and most of the significant outbreaks, like the one involving the choir, were in close indoor settings. So it's possible, obviously, to transmit outdoors, but it's a lot less likely than indoors.
Do you think the coronavirus could spread easily between people sitting together on a chairlift or standing in line for a ski lift?
Yeah, again, I don't think anybody's really looked at it. Social distancing is important, so I don't know that you can maintain 2 meter distance between individuals on a ski lift. But I guess the best that you can do in terms of maybe separating the individuals and reducing the number of folks on the ski lift makes sense. I think it's possible, certainly, for people to distance themselves by about 6 feet while standing in line. So that would certainly make sense to do.
How easily does the coronavirus spread indoors, say in a ski lodge?
I think ski lodges, at least my vision of them, is that they're fairly large spaces with high ceilings and decent ventilation. So that would reduce the likelihood of transmission. I guess, again, it's a matter of, can people maintain adequate social distancing? Will people wear masks? And if they do that, it should minimize the potential for transmission in a ski lodge.
That's good. I'm quite confident all ski resorts will require masks indoors. I think they're going to require them outdoors too, when you're riding the lift, waiting in line, maybe even while you're skiing. I'm sure that'll be a bit of a gray area. Why are viruses like the flu and coronavirus more contagious during winter?
So I think the general sense is that it's because people spend more time indoors in fairly close proximity to one another. They're less, spending less time outdoors. So given that it's easier for the virus to be transmitted indoors, that's probably the reason why there's more transmission during winter. Although we don't really have history for the coronavirus as to how it's going to behave, but the assumption is that it'd be similar to flu, that it is more readily transmitted during the cold winter months.
So Scott via Facebook asks, will the cold temperatures slow the transfer of the virus on objects?
I think the answer is nobody knows. It's thought that the transfer from objects, where someone coughs on a surface, someone who's ill, and then another individual touches that surface and puts their hand to their mouth or their eyes or their nose. It's thought to be a relatively minor route of transmission compared to the respiratory route, where someone is coughing out respiratory droplets that then come in contact with the mucous membranes of the susceptible individual.
How does the coronavirus spread?
So the consensus is that it's primarily being spread by large droplets that particularly get exhaled during coughing or singing or sneezing. Apparently also, just by regular breathing or heavy breathing. These large droplets that are typically more than 5 microns in diameter can travel relatively short distances before they settle out. So that's the basis for the 6 feet distancing, because those droplets tend to settle out. Sometimes people say at 1 meter or 2 meters, 6 feet. So the person who is susceptible winds up getting the droplets. They impact on the membranes of the mouth or the eyes or the nose, and then set up infection in that way. The contact transmission that we were talking about before seems to be an uncommon route of exposure. I don't know that it's really been documented. The virus doesn't appear to stay viable on surfaces for a very long period of time. I guess because of that possibility, good hand hygiene is important. So you want to wash your hands after you commonly touch surfaces to avoid that possibility.
How much more deadly is the coronavirus versus the influenza virus?
I think you already mentioned this. I think the initial mortality rate was higher than what it is currently. And I think that's because treatment is a little bit better, or management of ill individuals is better than what it was initially. But I think what you said is about right, that it's about 2 to 3% compared to 0.1 to 0.2% for influenza.
There's been some people talking about how the combination of influenza and coronavirus could cause real problems. And I just wanted to clear up, are they referring to people catching both viruses at once, or are they talking about both viruses kind of being separate problems and potentially overwhelming hospitals?
Well, there is, an awareness that there could be co-infection with both viruses at the same time, but I think that's likely to be fairly uncommon. You might imagine that the individual would be more likely to get sicker in that situation if they were infected with both viruses. I think one of the concerns, though, with the coming flu season is a couple of things. One, it may be hard to distinguish the flu, which has similar symptoms to COVID-19, hard to distinguish the two. So patients will present with fever and cough and other symptoms, and it will not be easy to distinguish one from the other without doing testing. So that's going to be a problem in terms of diagnosing illness. And of course, since influenza does cause significant morbidity, significant illness that sometimes requires hospitalization, the combination of the two being circulating at the same time, it would appear to be increasing the demands on medical services and hospitals and so forth.
Once a vaccine is here, how long will it take before we can, quote unquote, return to normal?
I think that's a good question. I mean, there's
that's a tough one.
There's nobody really knows. I think you've probably heard the concept of herd immunity, that when a significant percentage of the population is immune, either because of having a natural infection or because of vaccine, that it then likelihood of transmission decreases. There's a concept called an R0, R0, that is the number of people that a single infected person is likely to infect. And right now for COVID-19, that's somewhere in the 2 to 3 range. With vaccination and natural immunity, it's likely to drop considerably lower than that, so that there'll be maybe less than 1, in which case the pandemic will tend to stop, basically, because there's not enough generation of new infections. How long that's going to take to get to distribute the vaccine to millions of people, I think nobody really knows how long that'll take. But presumably, if a high percentage of the population is vaccinated, then we should be in a better position. I'm not sure that we're ever going to get back to the old normal in terms of close contact with individuals, hugging, kissing.
High fives are over.
Yeah. I think it's
gloves, ski resort high fives only with gloves on.
Right. That makes sense.
And so herd immunity, I've heard numbers thrown around, something about 70% of the population would have to have been infected. Is that about what you're hearing, 70%?
That's the sort of traditional concept. I think I've read some things that suggest that, even if only 50% of the individuals are immune, that you would get that benefit of herd immunity and have reduced frequency of transmission.
And with the USA at 2% right now, that's probably not a good goal for us. Is there a chance that coronavirus could stay with us forever and end up being something akin to the common flu?
I don't think anyone knows. That there's just not the experience. It's interesting that another coronavirus disease, SARS, which caused an outbreak a number of years ago, wound up sort of petering out on its own. It's not clear why it basically disappeared. So one could hope that this virus will behave similar to that and will wind up being reduced in terms of frequency of transmission and severity of illness and maybe go away, but I don't think anyone really knows.
If someone has been infected with the coronavirus, how long will they be contagious?
The studies that have tried to look at this, and it's difficult to study, but it's thought that the person is most contagious a day or 2 before they develop symptoms, and then for about 5 days or so after the onset of symptoms. That's the time that somebody would be the most contagious. The studies are suggesting that by 10 days, virtually everyone who had a relatively mild illness will no longer be shedding viable virus. They may continue to shed viral RNA, but in terms of actual virus that can infect someone, about 10 days is the time period that would be required for someone no longer to be contagious.
If someone contracts COVID-19 and recovers from it, does that mean that they will be immune from catching COVID-19 again?
So it's a very difficult question to answer. For seasonal coronaviruses, the ones that cause seasonal common cold, the immunity to those is not particularly long lasting, so that someone can get reinfected by those viruses. They may be protected for a matter of months, but then potentially can be reinfected. The evidence thus far is that it looks like reinfection, if it does occur, is very uncommon, but we only have a 6, 7, 8 month time period. We don't have sort of long periods of follow-up to understand really what's happening. The notion is that it looks like the antibody response, which is part of the immune response that would protect against infection, is most effective, most present during the first few months after infection and may decline afterwards. But there's evidence that that type of immunity may not be as important, or maybe the cellular mediated immunity by T cells may be more important in the long run. And even if there's a waning of the antibody levels, the T cells would be able to respond if the person got exposed again.
So if I get coronavirus and recover from it, I shouldn't just go running around licking doorknobs.
Yeah, I think that's probably
Good advice. Good advice right there.
Yeah.
So what is convalescent plasma? And do you think it will be a viable treatment for COVID-19?
So convalescent plasma is plasma that's taken from individuals who've had infection with the virus and have developed antibodies. It's called convalescent because it's taken from patients that are convalescing from infection, or individuals that are, after they're no longer infectious, take their blood and separate out the serum and then administer that to individuals who are typically very sick with coronavirus infection. And there is evidence that in that setting, it can be effective in terms of reducing the severity of the illness and perhaps preventing mortality from it. The problem is it's obviously a very intensive kind of treatment, requires a lot of logistics in terms of getting plasma from previously infected individuals and making it available, and administering it would have to be administered intravenously. So it really has limited application, but for those patients who are in the hospital and very sick, it looks like it might have some benefit.
Might be challenging to scale it up, I think, is what you're saying too, right?
Yeah. It's not going to be something for the entire population to get, and certainly not something to get prophylactically or preventively before infection.
And it may not be maybe approved just yet. Is that right?
So it's gotten, I think, emergency use authorization from the FDA, Food and Drug Administration. So I think it's considered approved for seriously ill patients in the hospital. It hasn't undergone the kind of rigorous testing that would be required before a drug or material got final approval from FDA.
What is hydroxychloroquine, and does it have any benefits in treating COVID-19?
So hydroxychloroquine is a drug that was and I think still is used in treating or preventing development of malaria in developing countries. It also has some utility in certain rheumatologic diseases, perhaps lupus or rheumatoid arthritis. There may be some benefit in those individuals. So it's approved for that use. The studies, that have been done thus far really don't suggest that it is efficacious against coronavirus. So I think it's not likely to be a useful treatment for the illness.
I remember taking that in Indonesia on surf trips. This stuff is weird. Are there drugs that do have some promise against COVID-19 right now?
So I'm not an expert in terms of treatment, but there's been benefit from, in fairly severely ill patients in the hospital, from use of corticosteroids, steroid medications like dexamethasone, Decadron, which can be administered IV and which seem to be helpful in reducing the ultimate severity of the infection in more seriously ill individuals. So that's promising based on studies. There are some antiviral medications that seem to have some beneficial effect, but thus far they're not extremely successful in terms of preventing infection. Obviously, there's a lot of research that's going in to try to develop effective pharmaceuticals that might be useful, but at this point we don't have a whole lot to offer.
That's an interesting answer, though, for us as mountain people, because dexamethasone is something that is used for acute high-altitude sickness, something that we carry as mountain guides. And there's an old, really funny movie called Everest, where whenever people get sick, people are yelling, "Give him the Dex!" Anyway, dexamethasone is back.
Yeah, so you knew about that.
I knew. We carry that in our backpacks as mountain guides. It's something to use.
That's very interesting.
Yeah, to try to prohibit people from getting really sick, because as acute mountain sickness could lead to high altitude pulmonary edema or high altitude cerebral edema if not taken care of. And so it's just one of the tools in our tool bag there.
Yeah, that's great.
Some people appear to have long-term negative health effects from COVID-19 infection. What do we know about the long-term health effects at this point?
So there's, again, limited follow-up period to sort of know. I think there is an indication that people can have lingering symptoms, particularly fatigue and malaise, after they've otherwise recovered from the illness. There are some reports of neurological and cardiovascular abnormalities that occur after the active infection is over, but I don't think we know enough as to how likely or how frequent those are. I think it's, for the most part, individuals who are healthy who develop mild infection probably aren't going to suffer from significant lasting effects, although they may wind up being fatigued for some period of time after the infection is otherwise over.
If someone has increased risk due to an underlying medical condition, what should they do to protect themselves?
I think the basic measures that we've already discussed in terms of good hand hygiene, hand washing, or use of hand sanitizer, maintaining social distancing at the 6-foot distance, but also probably avoiding being in crowded places with lots of other people, kind of staying at home, as much as is reasonable, and then wearing masks. Unfortunately, we don't have any other real tools in our tool bag that we can use to protect the more susceptible individuals.
Should we get the flu vaccine this year?
Yes.
Do you think that it's possible that the USA experiences another shutdown this winter due to the coronavirus?
I think it's possible. I mean, again, it
happened in the UK already. They had to do a second shutdown.
Yeah, and we know that other coronaviruses, seasonal coronaviruses, tend to cause more illness during the wintertime. The thought is that may be the case with SARS-CoV-2. And so if there is as they call it, a second wave, it may result in reducing or increasing the restrictions on movement and so forth, another lockdown type situation.
Yeah, so I think we're all scared. As skiers and snowboarders, we're scared that our ski resorts might get closed again. Please tell us a little bit about your involvement working on the coronavirus this year.
So I'm not on the front lines. I'm not actually taking care of patients with COVID-19. I'm mostly, as an occupational medicine physician, am working with large organizations to help them develop approaches to dealing with the pandemic, looking at policies with regard to mask use, travel restrictions, contact tracing when an individual becomes ill with COVID-19, trying to identify and reach out to close contacts and have them quarantined for 14 days. That's the kind of role that I've been in. So it's more in terms of responding to the problems from a public health standpoint and trying to allow organizations to continue to function dealing with the virus.
Yeah, and I know how busy you've been because of that. So thanks for your hard work on all that. So I know that you don't ski. Did you ever go skiing? Once or twice?
I once tried to cross-country ski, but it wasn't a good picture.
Would you ever go skiing again?
Probably not. I'm too tall and too far to fall and kind of clumsy. So no, I don't think I would.
Okay, so you don't ski, but if you did, would you be comfortable going to a ski resort this season, considering the current coronavirus situation?
Again, the fact that things are mostly outdoors or can be mostly exclusively outdoors, I think reduces the risk. And if you follow the precautions that we've discussed and use masks, that should reduce the risk. And I think I would be comfortable in going to a ski resort or similar kind of setting where, people are not going to hopefully be crowded up next to one another, can separate themselves by a reasonable distance and reduce then the likelihood of transmission.
Great advice. Well, that's all I've got for you. Thank you so much, Dr. Fischman. I really appreciate your time today. And thanks again. Thank you so much for listening to the Snowbrains podcast. If you liked this podcast, please share with your friends and family, and please subscribe. To find out more about Snowbrains, please visit us at snowbrains.com. You can also find us on Instagram, Twitter, and Facebook at Snowbrains. This episode of the Snowbrains podcast was brought to you by Alta Ski Area. The editing of this episode was done by Robert Wilkinson. The music was created by Chad Crouch. I'm your host, producer, and creator, Miles Clark. Thank you for listening.